Thank you very much. It's a pleasure to be here to moderate the Smart Health panel. I'm Kathy Kim. And if you'll bring up my next slide, I would just give a few minutes of introductory remarks and then introduce our panel. So first, I wanted to just talk to you about a use case for the connected health ecosystem. Let's consider a 70-year-old resident of a rural community who has two chronic health conditions, diabetes and hypertension, both of which have been steadily worsening over the last decade. Recently, they were transported to a tertiary care hospital and admitted, but this hospital is 200 miles away because they had suspected heart failure, so they need some diagnostics and some procedures. On discharge, the individual is faced with needing remote monitoring for their chronic conditions, their blood glucose, their blood pressure, as well as wireless monitoring for their cardiac status and other symptoms related to their heart failure. Unless they're going to travel 200 miles every week to this hospital, or even more frequently, they're going to need remote monitoring devices prescribed, fulfilled at a pharmacy that covers these connected devices, and then buy what's not covered by their insurance. For example, blood pressure machines are often not covered by insurance. They'll need a smartphone or a tablet to connect with these remote monitoring devices and access the data that they produce. They'll need to learn about their medications for all three of these issues and work out how to take them. They were also likely to be enrolled in a cardiac rehab program that will start in a couple of months, but nothing exists in their town. So they're going to need access to online health education tools, the rehab program guidance, as well as a virtual program that connects them back to the hospital's rehab program. Now they're being cared for by a local primary care provider who works at a community health center and being followed by a specialist or a cardiologist, maybe back in the big city. They'll all need access to the discharge report from the hospital, from ongoing clinical information, so they can effectively conduct their follow-up care. But the hospital also needs to know how the patient's doing back in their local community so they can help to prevent readmission. They may also need some telemedicine consults, which means the specialist and the primary care provider need to have systems that they can communicate with for specialty consults. And they're all going to need access to this data through a health information exchange. So add to that we need to understand what the social determinants of health are that this individual faces. And that may come from neighborhood or city data, that may come from the environment in which they live, and rural or regional population health data. So we need all this to be interoperable, documented in the right electronic health record system, and made accessible electronically to the patients as well as providers. So if we go to the next slide, you can see that the connectivity we need for telehealth, telemedicine, real-time monitoring for hospital at home, as well as chronic disease monitoring, data collection and exchange, and patient access exists today. The needs exist today. But these healthcare use cases require extensive collaboration with dire consequences if we're not supporting this real-time access. So these use cases rely on 5G, on Internet of Things, the cloud, and all these other new technologies that, including artificial intelligence, that patients and providers both need. However, healthcare is done in person and as well as in real time via technology. Patients and providers need to be together for procedures, for shared decision making. Patients may need in-person support for technology adoption, and in particular for digital health equity. So these technical models enabled by 5G have to be complemented by programs that support patient-provider relationships, trust in technology, and adoption by patients. So these are the kinds of topics that we're going to talk about today in our panel. So I will turn to the panel and ask that each of them introduce themselves. So we'll start first with Dr. Juan Lopez Solorza.
Hello, everybody. It's a pleasure to be here. My name is Juan Lopez Solorza. I'm a family doctor of about 22, 23 years, and I've been at Livingston as a social medical director along with their clinical education program that we're rolling out. I've been here for 2 years. Happy to be here.
Thank you. SM Hasan.
Yeah, hi, everyone. Thanks for inviting me to this panel. So my name is SM Hasan. I'm the 5G platform leader at GE Research, currently leading our 5G strategy for GE. I'm working in the healthcare industry for almost more than 12 years right now. I actually leading multiple 5G internal program and also was leading our internal wireless patient monitoring project. I have a background in wireless communication, did my PhD from Virginia Tech in software-defined radio and cognitive radio area.
Thank you. And Peter Linder.
Yes, my name is Peter Linder. I joined Ericsson 30 years ago and have spent roughly half of my career in the area of fixed broadband and the build out of that in the first half of my career, second half on mobile broadband and the development going on there. Over the last 4 years, I've been in charge of 5G marketing for Ericsson in North America and thought leadership. And in that, I spent most of my time not so much explaining what 5G is, but more where can we use it and helping people see that it's something that is a little bit more than just a faster connection to your smartphone.
Thank you. So we have some prepared questions and issues to discuss with the panel, and then we will take some audience questions at the end. So I'm going to start with Dr. Lopez Solorza. So as a physician who works in a community health center, and I know you serve low-income and rural patients, how did the pandemic change your health center's approach to virtual care?
It's amazing how one, people didn't come, right? There was such a major fear factor of even just coming to the clinic thinking they might be exposed to COVID. So many chose not to, thinking it was safer to not come. Because of that, we saw a resultant worsening of many chronic illnesses, including preventative care. So mammograms, colon cancer screenings, pap smears, all were on the decline. Blood sugars worsened. Although I will say, right, I think there was a positive that people were probably more outdoors, more bikes were sold, and so they were more active. So it was a combination of things. But in general, we saw many of the health statistics worsen to some extent, including just simple weight gain. People were at home Netflixing tremendously and eating a lot as well. Yeah.
So how did this change the appetite in your health center to try and do something about virtual care?
You know, it's interesting and again, I am a big proponent of trying to practice well. So it's interesting how some folks enjoyed the slowdown from the provider standpoint because it wasn't as crazy and it wasn't as busy. And maybe because we didn't have to hit all those marks of check off your mammogram, check off your pap smear, check off all the other things that we do in healthcare maintenance, right? It seemed to be a slowdown. However, right, we knew we weren't providing care, right? So that was a big, big problem at some point. And it made it even difficult for people to make follow-up appointments and come back when you're really trying to get somebody under better control, whether it be blood pressure, whether it be diabetes, whether it be weight. Yeah.
And I'll just preface this next question for Dr. Lopez Solorza with a disclaimer that MITRE and Dr. Lopez Solorza's clinic implemented a program called Activate, which was a platform to provide digital health services to the patients. So I will ask you, Dr. Lopez Solorza, can you tell us a little bit about your experience with the Activate project and providing real-time remote patient monitoring in the home?
Yeah, so, you know, before even that, in the underserved community, we definitely had problems regarding telehealth visits, right? We weren't allowed ever to provide a telehealth visit, whether it be a telephone visit or whether it be a video visit. And so we all had to scramble quickly as to figure out how to do it, i.e. to, one, stay in business, and two, provide care. Because now we were able to, for lack of a better word, charge for a visit that traditionally we could not do. So we went through that hurdle of figuring out who do we use. At that point, we used Luma Health, but all technology, right, isn't always geared towards the provider developing it. It's the reverse, right? It's something gets done like a healthcare system electronic record that was done more for billing than for the provider use. So we actually had to retrain and troubleshoot and pilot and figure out how workflows would kind of work. However, once we worked really well with MITRE and figuring out the workflows, we were able to get a fair amount of patients involved, and those patients would then send us, right, via the way we've done it, to get their records for blood pressure monitoring and blood sugars, allowing us to not necessarily see them when we just saw them 2 weeks ago or a month ago, to evaluate their records and their data to make a decision clinically if we needed to make a change or not. So it was tremendous. And the patients, it's amazing, there's always this thought about certain subgroups that can't use digital health, right? So a health coach that helped digitally prepare them and and be ready brought them up to the next level of digital equity, which we're all striving for here. But allowed them to feel way more comfortable with the tablet, and we continue to evolve that, and hopefully they'll be more able to connect with us, right, virtually, as opposed to just the Activate program in the future.
And has this had an impact on outcomes for your patients?
It has. It's tremendous. So, you know, people's A1Cs and blood pressures have gotten under much better control. I don't know what it is, although you're very right that blood pressure monitors were not ever covered in my history for at least Medi-Cal managed patients. Somehow or another doing this, they knew that their doctor was, or the provider was, observing their data. So people took it really seriously, and it was a much greater effect. And although we know people can check their blood sugars at home and monitor it, it did not have the same impact as if we were partnering with them and helping them improve it. So we saw drops between 1 to 2 points, which is just as good as one medicine that we prescribe for a diabetic. And in some scenarios, right, you saw an A1C of 10, 12, which is very high, drop to a 7 or 6, and you know that's more rare, but people did just amazingly take it, and we got results. Yes.
Thank you. Let me move to Peter and ask you. So how do we best help providers connect, especially primary care providers and generalists? And how do we do that, especially in rural and remote areas?
I think that the pandemic has been interesting in the sense that it changed fundamentally three things that we used to do. We used to go to work, we used to go to school, and we used to go to the doctor. At least those three things happen in a family. The pandemic pushed it quite strongly on all these different fronts, and I would say that it's pushed it on both sides of the equation. So when I think about it, like the care situation and so on, it's not only about the patient that became comfortable with sitting like 3 feet away from a screen and talking to the doctor. It's also the practitioners that took advantage of the other side. So I think we've accelerated this, like getting over that hurdle and getting it over like all of society on both sides of the equation at the same time. And the fact that the pandemic took a while, so we perhaps could create sustainable experiences or behaviors. What I see was key was a little bit the access to broadband in one shape and form, so we can move beyond the call that was just between two voices to being a call between two faces. I can see it how it reacted with my mom. That was like the kind of trigger. I could never have convinced her that video telephony was a great thing. But during the pandemic, when we couldn't meet, that created a different relationship. And I think right now, as we're moving towards a more kind of a hybrid thing, if you're living close to the doctor, I guess you might still be able to go in there. But for a lot of people living further away, I think that it'd be absolutely fundamental that we have good broadband to those ones. So you don't have to drive 20, 30, 40 miles, and especially if you're dependent on something on a continuous basis. So what I envision is that we will continue to rely on broadband, and I will make more emphasis on getting the people that are not yet connected so they can participate in this evolution.
Now, what about hospitals? We talked about providers and patients. What about hospitals? As hospitals get more and more resource constrained, how could 5G help to bring hospital care to the patient at home or outside settings?
I think it could happen quite a number of interesting things. The first thing that we can get, we can leverage is 5G at the hospital or at the hospital grounds. So, for example, if we're monitoring a person that is at the hospital, not only monitoring when they're in bed, but monitoring when they're walking around in the buildings and also perhaps walking out in the green areas outside, so that we can really tracking and see what's going on. I also think that we'll see 5G being used more to provide the smaller hospitals or remote caregiving locations an opportunity to be connected in a new way. We see it happening in the business sector, where we connect a lot of branch offices right now with 5G. It's gone from being before a little bit of backup technology with 4G, backup to fiber, to now being considered as the primary technology. And I wouldn't be surprised if we see that a lot of these smaller remote locations having 5G access to the building, and then taking advantage of that for giving the care, both for the people that walks in there and the ones that's living around and about.
Great. So Hasan, let's talk about some of the data streams that we're getting now. We have the hospitals connected, we have the providers connected, we have the patients connected, and sensors and patient monitoring devices throughout our industry or throughout our setting. So 5G would enable data streams from these various healthcare devices. What kind of analytics or insights could we get from this that we can't do now?
Yeah, I think you are right, Catherine. I mean, the 5G is not only to enable, or making our medical devices to become a wireless device, right? We are not seeing that as a only transmitting data wirelessly. What we can do with the data, I think that's where the value coming from. So in my point of view, there are two areas we can see significantly improvement, because the first area is the improvement in the hospital operational efficiency. Because as we all know, our hospitals, healthcare facilities, they're very much resource constrained nowadays. And there are lots of patients coming into the hospital for COVID and also different other reasons. They are having some crises on, number of shortage in the nurses, right? In the other kind of resources. So there are a lot of issues in the hospital going on from managing the day-to-day operation, right? So just to give you one example where 5G can help, inside a hospital, they have lots of different devices, medical equipment. Even in our company like GE, we have 4 million devices right now in the field, right, in different hospitals. Different time, the hospital, they actually do not have any clue where a certain device is located where, right? So that asset tracking, right, the real-time asset tracking of a certain equipment and device will significantly improve the operation in a hospital. And the promise like 5G is giving, especially the Release 17, right, with centimeter level accuracy, having a very ultra low power 5G modem, that will actually revolutionize this. And so if we know the real-time location using a simplified, infrastructure like 5G, I would say that will definitely improve the overall efficiency. And if we can feed that real-time asset tracking information, right, and combine that with, say, utilization of that device, like real-time resource allocation, space optimization, I think that will provide a lot of value too. So that's the operation side. Now the other important thing would be the improving the clinical outcome, right? Because the ultimately hospital job is to make patient life easier and make them kind of get well sooner. So there is a scenario like when the patient is being transported, through ambulance to the hospital. If the hospital already have that real-time patient monitoring information, right? And if that data can be combined with, say, existing EMR data, existing imaging data, then before the patient, arrive, they will already have some plan what to do with the patient, right? So I think from that point of view, 5G will also play a very, very, very important role. And then the final thing I'll just touch on here, the AI is getting a lot of popularity in healthcare, right? I mean, there are some data there, artificial intelligence, market would be 52 billion in healthcare by 2027. So now if we have a stream of data, we can start doing the analytics. Then the discussion would be how we can employ more and more AI so that we can take human out of the loop, right? We can make more independent decisions. So I would say from all of these, 5G can actually enable that and act as a backbone, all of these activities.
So let me ask this this next question, which is, network slicing is a really exciting feature for 5G. What are the technical and business challenges that need to be figured out so that we can get the full benefits of that?
No, that's a very good question, Catherine. I mean, I know that Dr. Juan, I mean, he mentioned about the patient was watching Netflix, right, during the pandemic. The same analogy, I mean, the network we have right now on the cellular network, that is a Netflix-friendly network, right? There are a lot of download speed, very minimum upload speed. So definitely we need a different kind of network parameter and settings to apply it for industrial application, especially for healthcare type of, applications. And we need a different type of quality of service, for different devices. That's where I think the network slice can play a very, very important role. But there are a lot of, I would say, technical challenges we need to figure out. But maybe I'll touch on maybe a few of those. Definitely, first thing we need to do is that standardize the definition of network slice, right? I mean, the 3GPP, they included some definition. They included EMBB, MMTC, or LCC as a standard network slice under the specification. But many times those three slice might not be enough for covering different use cases, right? So as an industry, I think we need to come up with some terminology that what can be the network slice if you use the combination of those different slices, right? The second thing is that we need to make sure that we can deploy those network slices from the UE or the device. Analogy to the healthcare industry is that maybe my patient monitor, say we have a patient monitor, right, which can monitor the patient vital in ICU, right? So that same patient monitor, if it is a wireless device, like GE offer a wireless patient monitor, so that can go with the patient in the general ward, right? It can go with the patient in the home. But when this device move from one care area to another care area, the requirement. So how the device automatically tell the the network that, hey, I don't need this 1 millisecond latency because I'm not in ICU anymore. Please change it to 100 millisecond, right? I'm in general ward. So how device can tell the network and the network can automatically deploy a certain slice, I think that's a very technical challenge that we need to figure out. The other thing, I mean, when the patient move from one network to another network, right? Patient might be in a private 5G inside a hospital, but when the patient being released in a home, they might be in a certain mobile operator network. But how can we make sure the same slice actually works like between different mobile network operators? So that interoperability among the slice of the MNOs is a technical challenge that we need to figure out as an industry. The business side, I think because we need to make money, right? As a device manufacturer, GE needs to make money. Mobile operator, if they provide the certain network slice, they need to make money, make a profit out of it. Now, how can we do that? What kind of mechanism? What are the KPI? Should GE charge hospital a certain amount, to providing certain quality of service, and then that revenue goes to the mobile network operator, or there is some other way. So that business model, that kind of business, innovative, novel business idea needs to be figured out too.
Peter, looks like you had something to add there.
No, this is one of my favorite subjects. I think when network slicing, I think this very much, to me, it starts with helping people to understand why one slice doesn't fit all. And this is essentially as big, this topic is as big as people have been driving around for roads forever without any lanes. There have been buses and cars and bikes and everything going on, but there's no lanes. And all of a sudden someone comes and say, hey, I think I could create a better world, but if we put in lanes here and create some more orders, so certain things go in certain lanes. And then all the cars will say, hey, before you, like if you take out the lane for the bus or take out the lane for the bike, it only makes sense when you explain to people, oh, we need this for the bus because otherwise the bus won't go in time. And we need this for the bikes, otherwise it's too dangerous for the bicyclists to be here. And I think it's a little bit the similar journey we have ahead of us here regarding network slicing. It's not enough for just saying, hey, a slice. Yeah, which slice and why? And then putting that into some kind of a context, you see, this slice is absolutely important for healthcare because we don't want a Netflix package to drive over your life-threatening data bits. And in getting that kind of things going. And then perhaps starting small. So we're starting, perhaps we have a health slice, we have an education slice, whatever the slices might be, and then making them more granular over time. So not trying to, because we're going from 0 to 200 overnight won't happen. It's perhaps if we can go to 0 to 1, 1 to 5 and 5 to 10. Thinking a little bit, I see as FirstNet, when we created FirstNets, it's not the slice, but it's where we reusing some parts of the network and then having dedicated things for first responders and for consumers, and trying to implement some kind of that kind of thinking, saying, isn't that the way we should be building network? So we don't go down with that avenue that every single thing need to have its dedicated network, or the other only option is it's one slice for everybody and without any prioritization at all. So I think these are some of the questions which I think we have technically is pretty straightforward. So I see more of the challenges on like adopting a mindset that make this happen and happen in scale.
And as you both mentioned, the needs of the various medical devices and provider and patient access may change even in the home setting, right? In some home settings where we're doing chronic disease monitoring, where it's a periodic, data collection with a random blood glucose meter, you're doing, a finger prick, and every once in a while, several times a day, you're sending that data. That's a very low bandwidth kind of requirement. But if you're doing hospital at home where you have multiple monitors, multiple sensors, and critical data needing to flow real time, that may require a completely different setup in the home. In addition, for providers who are accessing these systems from home or from remote locations, not at the hospital, they might have a much more critical need, for that intensive monitoring data than they would for the chronic monitoring data. So any thoughts about how we can actually come together to make these decisions about network slicing under those conditions?
Yeah, I think I can start, Kathy. So yeah, I mean, as Peter mentioned, we need to start something with small, because the network slicing is a very novel concept in 5G, but there are a lot of things needs to figure out. So we need to start with some smaller POC. And just even within the healthcare segment, there is a different, as you mentioned, Kathy, the different type of devices, right? The need in the patient monitoring device might be very different than the imaging device, right? The imaging device will need a very high bandwidth. They don't maybe care about that much latency, but the patient monitoring, data is not that high, but you need to have a very low latency, right? Deterministic latency. So we need to test that kind of use cases, POCs, in different scenarios. But I would emphasize more on the interoperability side of it, because the 5G, the main reason we are interested in, it is a very flexible technology, right? And GE is a global company. Our device needs to work in 160 countries with 160 mobile network operator, right? So interoperability is a very, I would say, absolute requirement for us. So as a industry as a whole, how can we make sure that whatever the network slice, or Peter mentioned about the FastNet, whatever that kind of criteria or technology we create, we need to make sure that it is interoperable among the mobile network operator and also among the different medical devices, right? Not only GE, also from Philips, Siemens, right? Other people. So I think that would be a very big challenge that we need to figure out.
Yeah, and I think it's very much also when we're looking at from the ecosystem challenges and so on, and what we're going to start with, like finding some of the anchors you can get going with in the beginning. Say 2 or 3 things that is interesting enough so that people see that it's big enough problems to work to go after, but it's also possible to scale around those problems. So if we find up a good solution for some 3 base problem, that we can scale that pretty far, because the further out we scale it, then the more thing we will learn about what really will matters to those patients and other things we could add down the road. I often use the metaphor of how hamburger chains started. They had to be really good at burgers, French fries, and sodas. And with that, you could scale to a fairly large amount of customers. You can open new restaurants and more franchises. And in this context, that is scaling to more and more different this hospital and caregiving locations. Then, when you're at that point, then you can listen very much. What are people talking about? Do they want a big hamburger and fries when they come in at 6 o'clock in the morning, or do they want a cup of coffee? perhaps you should add something like that to the menu. And growing, so there's two different trajectories here which we can grow use cases on. One that makes the basic things and some of the devices scale, and then other things that we add on top of that one down the road. And I think it's something like that that need to happen here. And it's very much a cross collaboration across former industry boundaries, since it's industry verticals, it's IT, and it's the networking folks, that all of them sit on very important pieces of the puzzle here.
So let me ask this question about provider and patient adoption. First, I'm going to go to Dr. Lopez Solorza. Do patients and providers know what 5G is?
I don't think so. I don't think so, right? I think all they really care about more is does their phone work, and does the video come on when I try to connect with them, and when it doesn't, it freezes up, I have to call them. So I don't think they do, at least not our patients here.
So we have some education to do. So Hasan, what's the value of 5G for patients and providers? What do we need to tell them?
So that's a good question, Catherine. So the way we do from our side, I mean, we never try to sell a certain technology to the customer, right? Or do not want to educate them with a certain technology, because healthcare industry, Dr. Juan knows about that. We always tied our solution and technology with their, clinical outcome, right? How can you improve their clinical outcome? How can you improve their workflow, right? If I tell them that, hey, by using this wireless patient monitoring device, you're gonna reduce your nurse's time by 30 minutes, per day, I think that will resonate more with them than just educating them 5G, right? So that's where our angle is. We always try to focus on the clinical outcome workflow. So as a wireless community, we need to figure that portion out, right? We should not give a burden to the healthcare industry to them to understand 5G. We need to do the translation for them, that how 5G can improve those few areas for them.
I can give an example. I can give one example of this. This is true story. My mom, she is 100% convinced she don't need internet and she don't need fiber. She'll be perfectly fine with those one, because she is having iPad and Facebook instead of internet and fiber. She don't understand that my sister and I put the SIM card in her iPad. She just thinks that works, and you can do those things instead. And when I tried to explain to her I'm working with 5G, it took me 6 months to convert her from G5 to 5G. And I think that for a lot of these people, understanding that what we are doing and the difference it can make is very, very hard for them to get. I think we have to talk about what the benefits it can give and what the alternatives would be for something like that. So imagine if we had the scenario where old people start to take their stroller walking down to the coffee shop because they've heard on the news that it's time to update the software and the pacemaker, and doing those kind of crazy things, rather than being confident and secure about, hey, a lot of this is taken care of behind the scenes. My things are connected and it works all the time. I don't have to worry about it. So if we can find them one good reason why they should have this, whatever the clock, alarm, whatever it is, the device that they're using, and then that we hide in a lot of different things like software updates, automatic measurements, alarm, hey, now you need to go out and walk your steps, or whatever it might be. And just getting to the point, as long as they can see value in adopting it without necessarily explaining all the different things. Because I don't think my mom is alone with this kind of view. And I have tried to educate her, because I think at least getting the number and the letter right, we're there now, but it took a while.
Yeah, so I think this notion that you all talked about of not selling 5G, but showing what the value is in real life, in their practice, in their lives, is how you sell the value of 5G, right?
Yeah, I've seen it. When I was really, really proud of my mom was when the electricity company came and were replacing the electricity meter, and she asked what he was doing and what it would mean to him. and say, well, so how does it talk with you guys back in the electricity company? It works with 4G. And she said, dude, that's old stuff. It's 5G now.
Well, you did a good job then. So we have a question from the audience. How would network slicing work with Wi-Fi, which is the more likely network of choice in homes?
I can give it a stab at it. So if you look at a typical broadband connection, there's we talk about residential broadband. In a fiber, we typically have sufficient capacity, so we don't need to think about if we need to slice the traffic or not. You can see it as a 100-lane wide road, so there's plenty for everything to go. So it's not necessarily we have for a long period of time not really prioritized traffic in fixed broadband networks. And when you get to Wi-Fi to the home, the Wi-Fi is working in a similar way. The reason why we're talking about network slicing in cellular network and do it so much is that we have the cellular networks are sharing the spectrum, which is a scarce resource. And when you take a scarce resource and not creating a slice for all kind of traffic, then it's very, very probable that some of the important healthcare sensitive related bits might be squeezed out by something else, especially if that something else is large and consume a lot of capacity, like video streams. So there's a little bit of different thinking. That's not so much discussion about realizing network slicing over fixed broadband and terminating it in Wi-Fi in home as the discussion is in the cellular networks.
Yeah, I think maybe I can add a few more. So yeah, I see Wi-Fi and 5G, they're apple and orange, right? You cannot compare, directly with them. Each of them has a advantage, disadvantage, and I think they will be complementary. We cannot say that, hey, either 5G or either Wi-Fi. They will be complementary for a long time for different reasons. The network slicing concept, what we are talking about, is specifically for 5G. And some of the applications, for example, if you want to have a hospital grade monitoring at home, I actually do not want my patient to fiddle with that device and try to connect that with the Wi-Fi. I want, hospital already take off that connectivity. We do not want patient to think about, how it operates, whether it's talking to the hospital or not. So if you want to have that kind of feature, you cannot rely on Wi-Fi, because then you are moving from hospital Wi-Fi to home Wi-Fi. You are giving a burden to Peter's mom, right, to set it up to Wi-Fi, the 5G. So that's why we are talking about 5G, to maintain that kind of mobility, right, to maintain that kind of flexibility, security, HIPAA compliance, all these things. And that's where the advantage is.
So I'll remind the audience, if you have a question, please go ahead and put it in the Q&A. In the meanwhile, I will ask an additional question, which is, what do you think is needed to drive the expansion of virtual care and remote monitoring in the hospital, or in hospitals and health centers and homes? What do we all need to do together?
Right. The real value, right, of all of this is, which is improve somebody's outcome and life. At the very end, I think we have to be mutually respectful of that scenario, that this is meant to help. I think in the beginning, I think we can all be afraid, right, that too much information, right, can be handled. But I'm curious to see what kind of information we would find if we were, quote unquote, that connected, right, that we can weed out and have safeguards to help improve. Again, right, Fitbits tell you right now you've been sitting too much. Fitbits tell you should go for a walk. Fitbits tell you, right, you got to do some squats, something, right? So you extend what we try to say in a conversation, but now you're digitally connected and reminding people of it. It does help when you get reminded, right, of the things that you're supposed to be doing. And if you're doing it incorrectly, you can maybe even get a little, reminder, that you just had your third cookie. You're not supposed to, right? That's a little too much, but at the end of the day, right, it's meant to be for enhancing our lives, not hindering it, right? So I think once we put that kind of value, I think we all should be able to come into a community agreement that this is all for the good of us.
So Dr. Lopez Solorza, there's an additional question related to this, which is from the audience. What is smart healthcare's greatest value to a clinician?
I think there's a danger in the beginning because you think getting too much information. It is retraining the patients or the clients, if you will, on what to look out for more, right? Because you can be monitoring a lot of things. Next, you know, somebody's freaking out because their blood sugar's 250 because they ate ice cream. Well, guess what? It's supposed to be 250 if you just ate ice cream, right? Instead of them freaking out and saying I go to the hospital. And the same thing with a heart rate, right? Too low or too high, depending on those parameters, right? So it's a re-education as well as a reinvention of how we even train new doctors in the future, I think. And that's where I'm completely right on board, right? Incorporate this into sort of teaching and learning and providing it to patients in the future, right? Because some of us have to learn it later, right? And everything we do 5 years from now is going to be a little different because new outcomes, new studies have come out. And so we're going to change how we treat different things, right, over time. So.
Thank you. So we have 2 more minutes, so we'll take one final audience question. How can 5G be used to improve availability of telehealth in rural and resource-limited settings, places that have real need for remote monitoring given long distances and lack of availability to hospitals? Does it involve the use of bands such as C-band?
Yeah, so I think you can think about it like this. When we get out into to the countryside, I think we need to ask ourselves the question: if we're making the city smart, what can we do to make this countryside clever? And part of that thing is like what we typically face out there. We have two digital divides: one mobile and one fixed. And what we can do out there, if we see 5G as a technology that goes above and beyond fiber, not saying that we don't need fiber, but it's to complement to each other. Fiber far out, and then we can use the antennas, typically C-band or mid-band and low-band, to serve both fixed and mobile broadband applications. So I think the interesting thing that I think is funny is that in real life, we as human, we benefit from a fiber-rich diet and a big breath of fresh air. And the same thing goes, I think, in the rural area. Fiber quite far out in what we call the second mile or the middle mile up to tower locations, and then in the air from that for both fixed and mobile purposes. And that, I think, every single rural community should strive to get that sooner rather than later, because we don't want the rural America to be behind on that.
And especially now with the opportunity through the NTIA funding for digital equity, right? This is the opportunity is now.
Yes.
So we have 1 more minute, and we'll give each of our panelists a final statement, a final comment that you'd like to make. Hasan?
Yeah, so thanks again for inviting me, into this panel. I think there are a lot of ideas in 5G we can deploy in healthcare area, and it looks like there are a lot of applications there. But I would say we need to start small, right? We need to start with different proof of concept. We need to start with a different 5G network, in different hospitals, learn from it, and kind of expand based upon that. But there are some duties from the industry and the government side too. I mean, the industry side, we definitely need to push for more interoperability, right? How can you work together? The government needs to also maybe play some role, especially from the FDA side, that how they can, what's their, say, kind of rules and idea for certifying different 5G enabled medical devices, right? We need to get some clarity from the FDA. The government needs to fund more activities, like how can you apply 5G, say, many of the VA hospital, right? Making them smart hospital. Because we know, all of us know how VA hospitals, they're getting crunched by different resources and everything. So there are a lot of this kind of small stuff that we should do right away to expand these 5G based smart, health technologies.
Thank you. Peter, a final comment.
I think that what I think we should do is piggyback together with some of our brothers and sisters in crime, working from home, getting educated from home, and healthcare from home, both on the provider and the caretaker side. I think that one is super, super important. And also when we think about what is the best possible option here, that there will be complements of different technologies in different parts of the network. There'll be certain areas where will be fiber all the way to subscribers. There are other areas where we'll use 5G for fixed and mobile purposes. And there'll be areas outside of that where perhaps using satellite, but not saying that, hey, is it worth waiting 10 to 20 years for fiber when we could get it tomorrow with 5G, and seeing that as a real opportunity.
Thank you. And our final comment, Dr. Lopez Solorza.
Yeah, just quickly, I love the idea of a hybrid model where it's needed. I don't need to see a person every single month or 2 months if I know their blood sugars and they're doing well and doing a lot of the things, right? Changing the way healthcare is delivered, obviously, to have a half day that you're just doing telehealth with a great video, and you can see so much and do so much that way. Some patients like to come in, but the idea that they have a choice and option, and even the physician to have a little bit of a, I'll say, less of a commute, work from home is something that we haven't quite enjoyed that as well as other employees, right, in the regular workforce. But I think that is one way also to lead towards healthy physicians and providers.
All right. Well, thank you so much to our panelists, and I'll turn it back to our hosts. Thank you so much.